This is the relentless reality for NHS staff on a front line without an end in sight. As much as this fight has been about saving lives, it's also been one about dealing with death.
You do get a level of anxiety with looking after these patients. You could go on duty, receive handover for a patient, and they're fine. They're on a high amount of oxygen, but they're talking to you, they're communicating with you. And within hours, you'll get the doctor say they're now end of life. And it's like, what? Like, how? But they're still talking.
For many like Natasha, it's the speed at which life is lost that's the hardest to deal with. It's led to warnings that NHS staff could suffer post-traumatic stress disorder in the future. And this has prompted a response from those who've experienced trauma on a different sort of front line. Betteridge is a former commanding officer who served in Afghanistan. She now works with the military charity Help for Heroes, who've published guidance on self-care for NHS staff.
Anybody in the armed forces will tell you no two battles are the same, and this is a really unprecedented time with huge numbers of casualties, but there definitely are some parallels. The NHS staff and carers are leaving their families, they're donning a uniform, they're going into an unpredictable environment against an invisible enemy. And so what we're saying is, as you would in battle, there's a phrase that says, take a knee. So pause for yourself, look after yourself so that you can look after others.
Part of caring for the caregivers is making sure they have people to talk to. And NHS chaplains like Rev JACKIE GAYLE, who works in Birmingham, have been asked to help.
I asked them to express and explain to me what is it that they're feeling and what is it that they are trying to articulate. What feelings come to mind when you're saying it's one too many? What is it that you need support with? And that's how the conversation develops. So it's, as well as words, those feelings come to the surface.
Many hospitals are creating quiet rooms, better known as wobble rooms, where staff can go to press pause. Measuring the mental health fallout for staff fighting COVID-19 will take time. Until then, many are coping with a very human response to their heroic work. NATASHA, ITV News.